A sexual assault survivor tells us a local hospital failed her when they did not give her timely access to what's often considered the most important piece of potential forensic evidence. Focus team investigator Paula Vassan takes a closer look at how widespread this problem may be.
Did you feel failed by the system?
Yes, absolutely. The system is awful.
Olivia Landis is talking about our healthcare system.
It's just like made me angry.
The catalyst was May 2020, around the start of the pandemic, when she says she was raped by someone she knew.
I didn't know what to do.
But she did know to get help. She says she eventually went to the emergency department at Baptist Health in Louisville.
There's no handbook.
She planned to press charges, so she needed what many consider potentially the most critical piece of forensic evidence, the sexual assault kit, also known as a rape kit. Kentucky law requires hospitals with emergency services to administer the kit to anyone who requests it.
I was sitting back there for an hour.
Which turned into around 7 hours, she says, waiting in the ER. She says no one came to give her the exam she wanted, even though she arrived within the window of when it was possible.
There's like a 96-hour time frame in which the kit can be performed.
And after losing her sense of security,
he'd also threatened to kill me.
She says her wait in the ER made her lose something else.
And they said, no, too much time has passed.
Her ability to hold her attacker accountable.
You arrived at the hospital wanting a rape kit done, and you left without one.
Yeah. And I was furious because...
And without that piece of forensic evidence, she says she couldn't successfully press charges.
No, nothing.
Baptist Health turned down our request for an on-camera interview, citing patient privacy concerns. But they sent us this statement that reads in part, when a person who's been sexually assaulted arrives at our emergency department, the triage nurse immediately places them in a private room. An examination is performed by a sexual assault nurse examiner.
I was waiting for 6 to 7 hours just for people to come and talk to me.
Industry sources say at the start of the pandemic, when Olivia went to the emergency department, hospitals were facing some of their biggest challenges: strict quarantine policies, a rapidly spreading virus, and uncertainty. They were forced to prioritize patients whose lives were on the line.
I was in there fighting for myself.
So we wanted to know whether Olivia's struggle to get a forensic exam after she was sexually assaulted was an isolated incident. So we conducted a survey. We sent questions to healthcare workers around Kentucky. The results revealed Olivia is likely not alone. We collected anonymous responses from 64 sexual assault nurse examiners, emergency care providers, and other healthcare workers who have met people like Olivia during the pandemic. About 21% of respondents told us since the start of the pandemic, they've witnessed sexual assault survivors being turned away after requesting a forensic exam. Nearly 3 in 10 told us they've seen increased wait times for sexual assault survivors to receive these exams.
It doesn't surprise me, unfortunately.
We took our results to Deb Campbell with the Kentucky Hospital Association.
What does our survey reflect about the ability of our healthcare system to care for sexual assault survivors?
We just don't have enough nurses, period.
As nurses leave the profession in record numbers, largely due to the pandemic, she anticipates that shortage will swell.
Yes, absolutely.
Kentucky is projected to need 16,000 additional nurses by 2024. Factor in overcrowded hospitals due to COVID-19. Campbell says sexual assault survivors like Olivia have become among the many victims of a strained system.
Yeah.
What did you feel that you lost as a result of not getting this kit done?
Justice.
And Olivia tells us justice starts with being informed. If you're a survivor of sexual assault and need help, you can call a national hotline, 800-656-HOPE. You can also find the full results of our survey, along with local and national resources on our website, WHAS11.com. In the studio, I'm Paula Vassan, WHAS 11, on your side.
The Focus team investigates your stories. If you'd like to contact us, send them an email to focus@WHAS11.com.